Okay. This you see what this is what a plate of food looks like many times, right? And look at the amount of carbohydrates, that is bread, rice, puris, naan, all of that. And look at the vegetables and look at the protein. So this is a plate of food that can be what you eat. Well, what should your plate look like? This is what it should look like. Half of it has to be vegetables, a quarter has to be the starch, and a quarter protein, and milk and fruit. Rahul, you're paying attention, right? Yes. Okay, so will that plate method work for us, you think? You think yes? So this could be a plate of food. If you look at it, there's lots of vegetable. There's a small piece of chicken. There's a lot of lentils and one roti. Okay? What about this? Yes, look at the rice. So only a quarter of the plate. Vegetables are half the plate. And lentils, protein. What about this? Well, this is gobi sabzi. It looks orange, but that's what it's supposed to be. And this is paneer of some kind. That's what they tell me, the people who took this photograph. And you can see again, the concept is you cut back on the rice and the roti and the naan and the puris and try and balance it out. So this is, we have lots of vegetables, choices, and we make sure that that's what you choose. Milk, again, 1% or skim milk, and to stop using butter, ghee, and all the other high-fat, stop frying your food. And this is what I tell the hostesses, don't kill your guests, so try and be good to your guests. What about measurements? So we talk about measurements. God gave us the measurements, you're right here, you're carrying it with you. 1 fistful for your rice or carbohydrates, okay? 1 fistful. Meat, lentils, the palm of your hand. Thickness of your little finger. What about vegetables? Both hands, okay? And what about ghee and oil and butter? Your thumb. Thumbnail, not the thumb. Okay? So if you forget your measures and you say, I don't know how much to eat, what to do, look at your hands. Look at your hands. Give the measurement. So we made it easy for you. All right, so I see Surinder. He's come to see me, I'm the specialist, and his sugar is high, his blood pressure is high. His family doctor has said, okay, go see Dr. Khan or somebody like Dr. Khan to see what else can be done. And when I take a history, he's getting back into his old habits. He's not checking his sugar, and he's only doing it once a week. So I tell patients, it's like driving on the Queensway and not looking at your speedometer. You're going, but you don't know how fast you're going, what your direction is, or anything. So you do need to check your blood sugar regularly. Just know where you are and to know how to deal with it. Okay? And he doesn't take his medications regularly. How many times I tell my patients, your medications is for the food you're going to eat. So take it at the right time. Don't take it an hour before, don't take it an hour after, because then they don't work. And moreover, you keep your medications with you, especially if you're working, if you have medications at lunch, make sure you take them. But he has good intentions, as do most of the patients. He does want to improve things. So, this is where the key is. It's self-management. I tell people who are into sports, you're the player, I'm the coach. I tell you how to play. Once you're on the field, you've got to go and play. Rahul said he got hurt in soccer. So I can only tell Rahul how to play soccer, but I cannot show him. Go and kick the ball out. Right, Rahul? Yes. So, there it is. So again, it comes down to this. What can you do? lifestyle, meal plan, and activity are important. Weight, now there are lots of studies that suggest you don't have to lose a ton of weight. 5% of your current weight makes a big difference in the way diabetes control is improved. Medications for diabetes, there are several. The good news is there are 4 or 5 different kinds of pills, many times used in combination to get the effect of lowering your blood sugar. Insulin at any time. If your sugars are high and you don't have enough insulin, insulin is available. It's an injection, but most patients who use insulin will come back and say they resist. Oh, I don't want a needle. But when they start taking insulin, they feel so much better. They come back and say to me, I should have listened to you. I should have done this 6 months ago. I should have done this a year ago. So it's important to consider insulin at any time. The other 2 conditions that go with diabetes is blood pressure and cholesterol. So we need to treat all 3 at the same time. You can't treat one and expect that the complications of diabetes will not occur because they do have an effect. Now what about Surinder? Has he listened to all of us? Yes, he's tried. He's gone to the CDA website, he's looked at the choices of foods and started to make an effort. He started to walk, he's playing with his kids, he's started checking his sugar, he's taking his medications, and he's keeping his appointments. That's key to success. Now, if all my patients turned out this way, I'd be out of business. But the thing is that we're all human. We try, and that is the key. We have to keep trying. Now, what are the targets? So, he's making all that effort. So, where do we want his sugar to be? Definitely less than 7 in the morning, less than 10 2 hours after you eat. A1C, that's the 3-month average, less than 7. Cholesterol, the bad cholesterol, LDL, less than 2. And your blood pressure, less than 130/8. So if you are doing all of this, you get 100% marks. So how often should we check all this? 3 to 6 months, depending on how well controlled all of this is. So most of the patients, I'd love to see them in 3 months, but we have no bookings, no appointments, so we end up 4 to 6 months. Well controlled is 6 months, 4 months, 3 to 4 months if you're not. Okay, so what about the complications? Like I said, nobody really dies from high blood sugar, but it is what the high blood sugar does. It damages different organs in the body and causes a lot of complications, and I've highlighted in red. It's heart disease, eye disease, kidney disease, nerve damage, amputations in some people, and erectile dysfunction. Can all of this be avoided? Yes. So what do we need? We need to treat early and aggressive. So why am I concerned about Surinder? He's 2 years with diabetes. If we can manage to control his diabetes and keep it in the normal level the first 5 to 10 years of diabetes, we are going to delay all the complications I mentioned, at least for 10 to 15 years. Okay? Studies have been done where aggressive early treatment had sort of a beneficial effect 10, 15 years later. So that is the reason why when I see someone like Surinder, I'm excited and I'm anxious. I'm excited because there's time to do something about it. I'm anxious that if he doesn't, then he falls into that half of the patients who don't have good control and will develop complications. So that is the opportunity we have. So anyone here who knows people with diabetes or has diabetes, that's the key message. It's in that first 5 to 7 years that we need to treat very aggressively to keep everything in good control. Okay? What about diabetes? These are all common sense things. Okay? Healthy lifestyle, don't smoke, keep your weight in a healthy range, check your blood sugar, take care of your feet, manage your stress. This is important. So for all of us who are first generation, second generation immigrants, stress is a key element. It's job security, income, kids, everything, in-laws, parents. So we are in a stressful situation, but we also learn to manage. We need to learn to manage our stress. And we have different ways of doing it. As you know, somebody mentioned yoga class. Attend the yoga class. It's a de-stressing. Attend the mandir, the temple, whatever therapy you can get in a group. Releasing stress, decreasing stress is very helpful. Okay, and visit your physician and diabetes educator. We are there to help you. If you are, it's self-management, but the team is available to help you. Now, I just want to point out very quickly that all the complications occur much more earlier in South Asians. So as I said, diabetes occurs 10 years early, but blood pressure occurs. So the South Asians are the pink bars. And so you can see compared to anybody else, again, high blood pressure. And starting early, starting in 50s. Okay, so this is our curve. I'm not showing this to alarm you, but to signify that it's important. Heart disease. Heart disease. It's the dark blue. You can see heart disease and stroke, highest. Heart disease in South Asians, stroke in South Asians. Okay? And to say that if you do have chest pain, people have chest pain, go to the hospital. Don't think it's indigestion or whatever else. Because when you looked at the data, South Asians go to the hospital 1 hour later than the white Caucasians do. And that 1 hour is crucial because now we have therapies that can decrease the size of the heart attack. And most people now we find are requiring surgery. And Dr. Verma, who does a lot of surgery in Toronto, is very aware of this and lectures and informs all the South Asians. And this is key because South Asian anatomy is different. We have smaller blood vessels. So a lot of the times, 10, 15, 20 years ago, the surgical outcome, meaning surgery, was not so successful in South Asians. Why? Because we didn't have the correct instruments. We didn't, and in women. Now we have instruments that are able to use smaller instruments because our blood vessels are smaller. And so the surgical outcome now is much better because of all the new technology and new improvements. So a lot is happening in the South Asian community as more physicians and others are aware of it. Okay, and then what about kidney disease? Dr. Jindal will tell you he sees more South Asians than he wants to in his kidney clinic. We have more kidney disease. We have more people going to dialysis. So these are the facts. And can we change it? Yes, we can change it. So what we can do is, like I said, good treatment, early treatment, treatment to target, so that we don't develop the complications. Okay? So, now, what are the challenges? I listed some of the challenges. It's a chronic disease. It's fine for me to stand here and say, do this, do this. But in reality, what do we see? It is this. We see a lot of this. If you come into my office on any given day, my practice is downtown. So I have ethnic communities. I have people from India, Pakistan, Sri Lanka, Arab, the people who are not having skills for English. And when I first started practice, I was brown and I was a woman. So all the ethnic groups were sent to me when I was starting practice, because I was supposed to know all the different diets and all the different ways of treating. So that's how I got interested in my work with the Canadian Diabetes Association, to develop all of that. So language is a barrier. And a lot of the women we find are homemakers and are reluctant to do. So we stop using the word exercise. We use activity. Whatever you do at home, don't sit. Stand. If you can stand, that's better. So saying your prayers, stand. You're burning more calories. I stand and have my lunch because I'm burning more calories. So moving, not sitting, is helpful. And we don't know, when we're new immigrants, we don't know the healthcare system. Who do we access? What do we do? So teaching new immigrants about that is important. And fear of becoming dependent on medications. Remember, I said diabetes is chronic. You will need medications. You can, it's not a 3-month disease that you can stop. And this fatalism. Well, we're all going to die one day. Yes, but I don't want you dying of diabetes. That's what I tell my patients. Die of something else. Don't die from complications of diabetes, okay? If I can help it. So I tell them my mission in life is to keep you away from the heart doctor, the kidney doctor, and eye doctor. If I can keep you away from those 3, we've succeeded, right? We've not had complications. So that is what we want to say. And herbal medications, I'm not going to go there, but I know several people do take it. So the statement I would make is we don't know how those interact with the medications with you. There are studies being done in Vancouver and other places with different herbs and other Ayurvedic medications, but we don't have an answer as to how they interact. So when you take those, one has to be careful as to how you take them. So I mentioned the team. You have the nurse, dietitian, the physician, but the most important member of the team is you and your family. So the team starts with you and your family, okay? What about prevention? As I say, it's the best medicine, but you're not using it. It doesn't matter for diabetes or for anything else. Why? Why is it such a difficult concept? If I told you that if you start doing these 3 things, you'll live 10 years longer, you're going to look at me and say, well, I'm concerned about today, tomorrow, what my meetings are, what my school is. And next week, I'm worried about whether I get my bonus or not. 3 weeks from now, I'm worried about something else. I'm not thinking 10 years, 20 years, 30 years, 40 years from now. So I don't have time for that. I'm living now, these are my problems, these are my issues. So prevention is a very difficult concept to sell to anyone. So how do we do that? How do we do that? It has to be at every level. At the level of society, at the level of the family, at the level of the individual. Are we doing anything about society? No. We're going the opposite direction. If you look at new buildings, new communities, if you go to Toronto downtown, I was there last week for a meeting, you cannot see a single tree. There are no trees in downtown Toronto. There are no trees. What you see is a big basket of some shrub or something in front of the grand hotels. Okay? Downtown Toronto has no trees anymore. University Avenue has a whole 1 mile of small bushes. Everything is paved, everything is concrete, everything is just gone. So, society, that's where we're going. New housing, there are no sidewalks for people to walk because that takes up space. You could build another house. If you had 6 sidewalks, another building can go on. Schools, sports came back now, but before that it was an option in high school. So as a society, we are not doing what we do. I challenged one of the builders. I said, you're building buildings. Build a track, a walking track for your multiple dwellers. You owe it. Or offer a free treadmill with your house. That's what we need. If we have a fridge, stove, washer, dryer, why don't we have a treadmill in Canada? 6 months of winter. You and I know. We're not going to go out for a walk when it's -20. We're not. And so my question to the builder, I challenged him. So why don't you build a track? Why don't you offer a free treadmill to everybody? We can do it. We are not demanding it. We are not asking our municipal people to not approve buildings without sidewalks. So as a society, we fail. Yes? What about family? What can I teach Rahul? What can Hema and Manohar teach Rahul? To play soccer, regardless of whether he gets injured or not, play soccer. That's what I tell my nieces and nephews. If you don't do anything, your activity level, get involved in activity and do something every day. Because that becomes part of your daily routine, and that's very important. Okay? We grew up with no desserts in the house, no juices, no Coke, plain water or milk in the fridge, okay, and fruit for dessert. So if my nieces, nephews come to the house, they knew very well when they were young, they're not going to see Coke, they're not going to see any juice. All they'll see in the fridge is water and milk, and dessert is fruit, okay? Yes, we do make kheer, we do make sheer korma. When we have our Eid, we do have gulab jamun, but we stop there. Okay? All right, I'm coming to the end. Prevention. So I'll start with this slide, saying a healthy and active lifestyle. How much activity? 150 minutes moderate exercise per week. Keeping your weight and your waistline in check. And managing your stress. Screening for diabetes. So if you're in that high-risk group, you do need to have it checked. Okay? And all the resources available are there for you at the CDA. Is there an app for all of this to make you look at your watch, look at your app and do it? Yes, there are apps available as well to tell you how much to eat, how much activity. I'll stop there and take questions if you have any.
Questions? Yes, Arjun.
Dr. Khan, it was a pleasure listening to you. I was diagnosed with diabetes about 20 years back, and about 10 years back I was sent by my doctor on a research program at Riverside Hospital.
Yeah.
And I used to go there every 3 months, but the last year or so, or a couple of years, I've been asked to come there every 6 months, And about a year back, about 4 or 5 years back, I was put on insulin. Before that, I was on pills, medication. And I find that insulin gives me a much better control in terms of controlling my sugar level. I check my sugar level at least 2 to 3 times a day. They're not too often that the sugar level is up. We do socialize a lot and we travel 6 to 8 months, so that makes it very difficult to maintain control on what we eat, you see. But I do control the amount of insulin I take depending upon what kind of food I have eaten, so that certainly helps, About 2 years back, I was put on different medication. 4 or 5 years back, I was put on insulin, but then 2 years back, the doctor recommended I go on Lipitor, although I don't have blood pressure at all, you see. I've been 110, 70, 80, you see, for all my life. They put me on Lipitor just as a precautionary measure. They also put me on medication for helping the kidney, possible problem with the kidney. Recently, I was given a metformin combined with another medication, I can't remember the name, which is to any problem with my liver, you see.
So do you have a question there?
I'm coming to the question.
Yeah.
The last one that they recently, a couple of weeks back when I was at Riverside Clinic, they put me on, what's it called? The medication is something new, he told me,
Yes.
which when you take a pill a day, it takes the sugar out of your bloodstream. But he also mentioned that I'll have to very closely control my sugar level because there's a possibility that my sugar level might go down, so,
Yeah.
which has been the case and it has been difficult. Now, all these medications that I'm taking, including the insulin, is that a right approach to maintain to manage my diabetes?
Well, I can't comment individually, but what I will say is many times we have to combine medications to get the good effect, okay? So I won't comment on the case individually, but just to say that we do need to combine medications to get the good effect.
A question?
Dr. Khan,
Short question, please,
Yeah.
short, very.
Dr. Khan, the question of testing for glucose at home,
Yeah.
is this now recommended practice by all physicians?
It is, like I said, it's like driving on the Queensway without checking your speedometer. So that gives you an idea where your sugar is. So we recommend testing, and your doctor will give you the direction as to how many times.
Please go ahead.
Yeah.
Just a question here. According to the College of Endocrinologists in the United States,
Yes.
the limit of glucose should be less than 6.5 millimole per liter, whereas American Diabetes Association allows up to 7. So what should we believe which is the right one?
Well, what the reason is, the 7 was chosen because that's where the eye complications start. Okay? But if you can keep it below 7, there is no objection.
Go ahead.
So that is the reason.
Yeah, quick one, Dr.
Yeah.
Khan. You know, temple is the best place to start revolution, and you described the healthy portion, half, quarter, and quarter, right?
Yeah.
So can we, I'm going to ask a double question to Dr. Jindal, that can we start a movement? Because every week people come with prashad, I don't call it khana, right, prashad. Can we start a movement right here and then educate Brampton and Mississauga, where a lot of immigrants live, because that's where we get all the influence, buffet, wedding, all that stuff. I think we can kill it, kill the bud, kill the evil in the bud. What do you think?
I just want to, quick answer. We have introduced very subtle way. It's a very cultural issue.
Yes.
People resent it.
Yeah.
We have already started and slowly building up. Small portions,
Yes.
and that's what we are advocating. And it started a few months ago.
Good, thank you.
I just want to answer. Any other question? Yes, please.
Yeah,
Quick ones, quick one.
yeah. If you please expand on the linkage between foot problem and diabetes. If
The
that
foot
seems to
problems
mention-
are from nerve damage, so sometimes the sensation is gone. So you may injure your foot, or there may be an infection that you may not feel it. So we ask people to check their feet every day after your bath or your shower to make sure that everything is clean. So that is part of the foot care. So if you
So
attend the
it's
class,
a prevention or it's a,
prevention, yes.
I just want to add something that you brought it up. If you go into the kidney department, dialysis unit, if you take 100 people on dialysis, 40 out of 100 are due to diabetes. Once you get a kidney transplant, large number, not large, big percentage end up with losing legs. Why? You brought up this point. Not only is the nerve at the blood vessels, there's no circulation to the leg.